Hey guys, welcome back to Medical Coding with Blue. Okay, this is Answer Monday. Are you guys ready? So, I know I didn't do a whole lot of coding on this one, and this was more about the pharmacology stuff. But the thing is, I want you guys to be able to start looking at different things, not just the coding side. Yes, we all know the coding side, but it's these detail things that are really going to make a difference when you're out in the real world. And understanding what kind of drug classifications are what is really going to help you. Now, I will tell you this. This information did not come from one of those pharmacology books. This literally came straight from the ICD-10 book, the expert edition ICD-10 book. In appendix C, it has the pharmacology listings, okay? It has all the different classifications and what it's indicated for and things like that. So make sure that you're looking through your appendixes in the book, in the ICD-10 book and in the CPT book, if you're in the outpatient side, because it's very important. Those appendixes are there to help you. They're there to have additional information. And it's just very helpful at the end of the day when you can look at like the anatomy plates that are also in there as well. So just something else to point out. I mean, there's a lot of information in these books. So let's go ahead and get into the answers, and then we'll discuss some things at the end. All right. So number one, what kind of drug classification is Dulera? The answer, Dulera is a corticosteroid-inhaled. It's an antiasthmatic drug. Okay. Number two, what kind of drug classification is Eliquis? The answer is an anticoagulant. Okay. Number three, what kind of drug classification is Digoxin? I never know if I'm saying that right. Digoxin? Digoxin? Maybe? The answer is it is a cardiotonic glycoside. Okay. Number four, what is Factive and what drug classification does it fall under? The answer is for treatment of bacterial lung infections. It is an antibiotic. Okay. Number five, what is the ICD-10 code for Elestrin and what is it used to treat? The answer is Z79.890. It is used to treat menopause symptoms. Okay. Number six, what is the ICD-10 code for Oseni and what is it used to treat? What is the drug classification? The answer is Z79.84 and it is used to treat diabetes. It is an oral hypoglycemic. Okay. Number seven, what is the drug classification of Duragesic? You guys have the list. What is it used to treat and what is the ICD-10 code? The answer is an analgesic, as a narcotic for chronic pain, and the code is Z79.81. 891, I'm sorry. Z79.891. Number eight, what is the drug classification for Plavix and what is the ICD-10 code? It is antiplatelet and it is Z79.02. Okay. Number nine, what is the drug classification for Reclast and what is the ICD-10 code? The answer is a biophosphonate and Z79.83. Okay. And number 10, what is biophosphonate used to treat? The answer, prevention of the thinning of bones and osteoporosis, Paget's disease, and bone cancer. Okay. So while you don't have to memorize all of these drugs and things like that, it's important to know where to find information on them. What are they? What are the drug classifications of them? You can also go to the label website, whatever brand of medication it is. I'm sure there's a website for it from the pharmaceutical company, okay? This way it can tell you all about the drug and all of the other indications and just a bunch of information about it. So should you need to understand what it is. Now, there have been times when the provider will say, this patient has a DVT, they're on Eliquis, and we're going to continue with the Eliquis. So you would code for the DVT, and you would also code for the long-term use anticoagulant. Why? Because Eliquis is an anticoagulant. It's important because if we know that this patient is on a long-term use anticoagulant, it's going to put them at a higher risk for anything, for surgeries or anything like that, because obviously this patient could have a bleeding problem, okay? And if they are presenting with a lot of bruising, you know, if we know that they're on Eliquis, okay, they're on a anticoagulant, so we know that their bruising is normal, okay? It's just going to be probably more pronounced because they're on this drug. I mean, it's just any number of things. But really understanding what these are is super, super important. I knew that Plavix is an antiplatelet drug. I knew this, okay? And I did have this come up on an audit once, and the auditor fought with me because she didn't think that Plavix was an antiplatelet. And, or it's antiplatelet, isn't it? Yes. Yes. It's late. So anyway, she didn't agree with me. Well, then I went to the website for it, and it broke down everything that it was and all the indications. And so she ended up having to give it back to me, but she wasn't really excited about that. And she's not excited about it because, you know, I was right. And sometimes with auditors, it's a little bit hard for them to admit when they're wrong because it's their job to be correct. But it's also your job to make sure that you are advocating for your provider in every way that you can, whether it is advocating for them to get the highest level possible or to get a particular diagnosis code or whatever the case may be, a procedure. It's important for you to learn how to verbally communicate and express and show what you are using for your resources. And you always want to use things that are reliable. Going to the websites for the particular drug, if you're trying to argue for a drug application of a code, it's important for you to do that because looking at these things and having all of your proper arguments for this will help in the auditing process, because we all as medical coders get audited. This is not something that is a maybe. It is. I mean, it is a fact of our life that we have to be audited. And the reason that we are audited so often is because we need to make sure that everything is being submitted correctly and that there are no errors, that we are coding to the highest level of specificity possible, because it's important not only for the provider, but it's also important for the patient. You know, they take these records with them and they follow them wherever they go. So having the most comprehensive documentation, as well as picking up the correct diagnoses and the correct procedure codes, is paramount in our profession. So working closely with your provider so that they can make sure that they're doing everything that they're supposed to in order to capture what it is that they're doing in the first place is very, very important. So my advice is to get familiar with those appendixes. They will help you. And a lot of times when we're looking for answers, the answer is right there in front of our nose, you know. Once we look into the details, and it's all about those details. Okay, so I will be doing more of these with these quizzes, like on these particular topics like this. It's important because, like I said, when you're going in for those audits, it is the difference between getting something wrong and making sure that you cover yourself and have all your bases covered when it comes to code selections. Okay, so that is it for this quiz Friday Answer Monday episode. So I hope this was a good one. If you have any suggestions on future quiz Fridays, let me know and I will take it into consideration. So I'm going to go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next episode. Bye!